Good evening, everyone. Thank you for joining us on KREM 2 News at 6 o'clock. I'm Tom Sherry. Tonight we are joined in the studio by Sports Director Brenna Green. This is not a great night for us right now. With breaking news that Gonzaga's Mark Few was cited last night for DUI in Coeur d'Alene.
Yeah, he was called in by a driver who spotted him saying that he was driving erratically and speeding. He did not complete field sobriety tests, but did blow a .12 blood alcohol level. The legal limit is .08. A DUI in Idaho can mean up to 6 months in jail, a fine up to $1,000, and a license suspension up to 180 days. Here is a statement issued from Gonzaga Athletics this afternoon. Quote, "We are aware of the report that Coach Few was cited for suspicion of driving under the influence," said Director of Athletics Chris Standiford, who, by the way, is on his 7th day of the job after Mike Roth just retired. While the facts of the situation are still being evaluated, we understand its severity and the legal process that will follow. As a Gonzaga employee, we respect Coach Few's right to privacy and will refrain from further comment at this time. Okay, so let's talk about what this could mean for the team. The only real precedence we have is when Gonzaga basketball player Josh Perkins was caught drunk asleep in a running car in 2016. He was arrested for DUI and suspended for 2 games. That suspension was served over the team's exhibition game and Gonzaga's first game of the season. Few was actively driving, according to the police report, so depending upon how this plays out in court, this could be a longer suspension. If it does go longer than 2 games, that's a big deal, as Gonzaga's 3rd game of the season, counting the exhibition game, is against Texas in the Kennel. That will be a top 5 preseason matchup and, in my eyes, the biggest game in Kennel history. If Mark Few is not on the sideline for that contest, we simply don't know who's going to be coaching the Zags. Last year it would have been easy. It would have been Tommy Lloyd, but Tommy, he's now in Arizona. We don't know for sure who is the official number 2 on Gonzaga's staff. Is it Brian Michelson or Roger Powell? Unless something unprecedented happens and Few doesn't end up getting suspended, looks like we will find out at some point this season. The first time, as of us talking right now, that we are slated to speak with Mark Few is in a month at Craziness in the Kennel. That event takes place on October 9th, so we will keep you updated as this story obviously will continue to develop.
Brenna, thank you very much. We appreciate it. To our other big story tonight, the surge of COVID cases that are forcing North Idaho hospitals to adopt crisis standards of care to deal with the overwhelming number of COVID-19 patients. Our Mark Hanrahan joins us live from Kootenai Health, the campus there, to lead our coverage. Mark.
Yes, good evening, Tom. Just an unprecedented move by the hospital here today. They requested a transition, as you mentioned, into that crisis standards of care. They were granted that request. This as they continue to deal with that flood of COVID patients. Simply put, they're running out of places to put these patients or even the resources to treat them right now. And earlier today, the State Department of Health and Welfare here in Idaho held a press conference to discuss exactly what this move means. The director of the Idaho Department of Health and Welfare today pleading with the public to get vaccinated and avoid risky behavior that may land you in the hospital because right now they're full.
Particularly if you live in North Idaho, what it means is if you go to the hospital, you should expect a longer wait time. You may not be seen in a traditional space. In fact, you may be seen in a classroom or a hallway. Or you may be sent to a different hospital that has more capacity.
Nowhere in the state is the situation worse than in North Idaho, where a record number of COVID patients, 90% of whom are unvaccinated, are requiring more space and more care than at any time during the pandemic.
I think that the thing that's really changed for us has been seeing that younger patients are dying from this. And it's quite disturbing to see these patients declining, and they're what I would consider healthy. They're normal, everyday North Idaho people.
The state is now scrambling to care for all the patients. Last week, Governor Brad Little reactivated about 150 National Guardsmen. The state is also reaching out to retired or inactive nurses for help.
We've waived licensing fees for retired or inactive nurses so they can activate their licenses and re-enter the workforce more easily.
In the meantime, at Kootenai Health, COVID patients are now being treated in a converted conference space. ICU nurses must now care for more patients, and the hospital has had to turn away transfers. Dr. Scoggins does not expect the situation to improve in the immediate future.
With our positivity rate, we expect to continue to get patients. And I suspect that we'll continue to have our numbers grow over the next at least week or so. as there's not a lot of mitigation strategies in North Idaho right now.
As for the rest of the state, the situation isn't much better.
For the rest of the state, we remain dangerously close to crisis standards of care.
Back out here live at Kootenai Health, my colleague Ian Smay joining me here. And Ian, Kootenai Health held their own press conference today to talk about exactly what they're seeing in the hospital and what they have to say.
Yeah, Mark, as of earlier today, Kootenai Health was caring for 113 COVID-19 patients, and of those patients, 39 are in the ICU and 19 are on ventilators. And this surge in patients has caused Kootenai Health to convert classrooms and conference spaces into more bed spaces. In fact, 22 additional beds have been set up in the Health Resource Center. 7 of them were being used as of earlier today. Kootenai Health leaders said that levels of care are being affected, with some more urgent procedures being delayed in addition to elective surgeries. While emergency services are still being offered, Chief of Staff Dr. Robert Scoggins said if patient capacities continue to increase, the level of care offered will be affected. He also said that one way out of this situation is through vaccines, and Kootenai County's low vaccination rate of about 40% has been frustrating for local healthcare workers.
You know, I don't like mandates just like any other person in this area, but I do think that people need to make better decisions. And that if they want to make a personal choice, there is a right personal choice and there's a wrong personal choice. And right now, doing nothing is the wrong choice.
Another area being affected by the current situation at Kootenai Health is patient transfers. Normally, Kootenai Health only has to decline 15 requests over a 3-month period from other hospitals in the area to take patients in for care. In the past 3 months, though, that number grew to about 300 patient transfer requests being denied.
Ian, thank you very much. And in addition to reactivating the Idaho National Guard, the Department of Defense also sent a team of about 20 people here to Kootenai Health to help out. And tonight we're getting our first look at that medical team as they work in the hospital. We are told they are here to offer help to nurses and physicians, and that gives you an idea of just how serious the situation is here in North Idaho. And speaking of that situation here in North Idaho, it's not just the hospital being impacted. Morgan Trout joining me live here. It's also first responders, right?
That's right, Mark. Yes, Kootenai County Fire and Rescue says that they are having a 15% call increase, and that is really going to affect those wait times. So what we know right now is that this is affecting them, but it's also going to affect the hospitals. With Kootenai Health going into crisis standards of care, some medical procedures are having to wait. This comes as doctors say resources are being stretched to their limits, but they aren't the only ones impacted by the increase in COVID patients. Fire and Rescue Fire Chief Chris Way says he hasn't seen the region suffer so poorly since COVID first began, and it's changing the way EMS has to take care of patients.
It is hard. I mean, I think we're seeing, like I said, we're seeing really, really sick patients. We know that some of them won't survive. I mean, just because they've waited so long to get care, or because, you know, we're in this position of having hundreds of people that need care at the same time.
Way does want to reassure the community that you can still call 911 in an emergency because they will still come to you as soon as they can. I spoke further with Way about what he's going through and also what the toll this is on his team, but that will be in our newscast later at 10 and 11.
Morgan, quick question for you. I imagine first responders are in constant communication with the hospital, like, hey, we have a patient, can we bring them there? Is there a bed for them? Did you talk about that at all?
Yes, exactly. So they're actually calling it a partnership right now. So the Fire and Rescue team is working with Kootenai Health. They're talking every single day to see the availability and to also see what they can do to help alleviate the stress that's being put on the hospital.
All right, Morgan, thank you very much. Okay, we know that was a lot of information we just threw at you in a short amount of time. So for the very latest on the COVID situation here in North Idaho and that crisis standards of care here at Kootenai Health, just text us the word COVID to 509-448-2000 and we'll send the latest information directly to your phone. Live in Coeur d'Alene tonight, I'm Mark Hanrahan, KREM 2 News.
Still ahead today. Today marks the 1-year anniversary of the Babb Road fire, which destroyed the towns of Malden and Pine City. KREM 2's Whitney Ward is live with special coverage tonight.
Good evening. Yes, we'll be taking a look back at the devastating days immediately after the Babb Road fire, as well as the year-long road to recovery.